So today we're going to give you a little behind the scenes look of our two most recent harbor sale patients, Kimchi, who's stranded in Westport, Washington, as well as Aioli, who's stranded in Port Ludlow, Washington. So both of these pups were still dependent on their mom for milk and nutrition. They're not old enough to forage or catch fish on their own. So that's the reason that they were brought into care, into rehabilitation, because without their mom to feed them, they would not have survived in the wild. So when the pups first get here, usually for the first day or so, we're kind of hands off with them. We give them some time after a stressful transport to kind of chill out. We get them some hydration and some fluids. And then the next day we do an admit exam on them. This admission exam consists first of blood work. So we take blood from them to look at their total red and white blood cell count to look for any signs of infection or inflammation, as well as serum to check their kidney and renal function. We also do certain things like collect the pup's standard length, which is the length from the tip of their nose to the tip of their tail. So that's information that we collect both at admit as well as release. We'll also take nasal and rectal swabs from the pups, and those can be used to screen for a variety of diseases, one of which is influenza. So we're participating in some surveillance programs as it relates to that. And then we do a full physical exam, basically from the tip of the nose to the tip of the tail. So we listen to their heart and lungs. It's not uncommon for these pups to sometimes strand with pneumonias. Sometimes they can have heart murmurs that we want to monitor, keep an eye on. So we'll screen for that. Aioli in particular, he had a couple of wounds on the top of his head that had scabbed over, so we wanted to look at those for any signs of swelling or infection. Something else that we look at for these pups is they can get umbilical infections because they're still quite young, so they have their umbilical cord attached, and that can be a source of infection, so we want to make sure that that stays nice and clean. And then the last part of the physical exam or the admit exam is making sure that we can identify these pups. So they all get a hat tag with a color and a number. And once we have a lot of pups in care, that helps us to identify them so that we can make sure when they're in a pool and they're swimming, we can get those animals the proper feeds and medications. So then after we do the admit exam, typically if we have the pups in hand, we'll try and coordinate it with a tube feeding because that minimizes the number of times throughout the day that we have to handle these pups. In order to tube feed them, we pass a tube into their stomach, and then we listen in order to make sure that that tube is in the right place. And then that's how we pass the formula with that syringe.
Thank you all for supporting these pups through their care and for ensuring that they get a second chance out in the wild. Their food, medications, and time at the hospital are possible because of you.